Hi, I am Dr. Swaminathan Ravi. I am a plastic and reconstructive surgeon at Noble Hospitals, Pune. Reconstructive surgery can be scary for many people, and the information on the internet can be both helpful and overwhelming. So, we are here to answer some of the most Googled questions about reconstructive surgery. When the fingers, hand, or the entire upper limb is completely cut off because of any kind of sharp injury, it can be joined again within a few hours. We have to join the bone, tendons, nerves, blood vessels, and skin in a procedure which is called as replantation. If such an injury occurs, first one should apply tight pressure on the hand or forearm to stop the bleeding. Then the amputated part should be washed in soap water and dried with a clean cloth. This is placed in a moist gauze or handkerchief and kept inside a plastic bag. The plastic bag is then kept in another bag containing ice and water and rushed to a hospital where a plastic surgeon can start treatment. Ideally, any replantation should be performed within 6 hours of injury, but successful cases of finger replantation have also been done up to 24 hours post-injury. Following the microvascular surgery, the plastic surgeon will usually prescribe blood thinning agents and protect the hand in a plaster splint for 3 to 5 days. There will be plates and screws for joining the bone or steel wires which are retained till the bone heals. The first 2 to 3 days are critical since the tiny blood vessels can become blocked, leading to failure of the surgery. However, once the replantation is successful, physiotherapy and exercise is started to regain strength and function of the limb. The total recovery process can last from 6 to 9 months. So there you go, the top questions on Google answered. If you feel this information is relevant to you and you wish to seek medical help, come visit us at Noble Hospitals in Pune. Our multidisciplinary team is here to ensure that your health comes first.